right here and kind of dull and constant.
It's sharp, it's stabby.
It's like the right side of my abdomen has a headache.
All day long.
Then all of a sudden it's like whoosh, and it's gone.
If those women sound like you're not alone. We all have aches and pains that have us questioning, is this nothing or should I be worried? That's why we have dedicated this week to revealing the surprising reasons behind your weird pains. And the pain we're talking about today feels like this, right? First off, it's severe, sharp pain in the lower back. It may spread down to the groin area. It comes in waves, and it feels like maybe you pulled a muscle, but could be more. Back with me is emergency room doctor Samson Davis and gastroenterologist Dr. Rashini Raj. Dr. Davis, when someone comes into the emergency room and they say, I've got lower back pain, what do you suspect?
Yeah, so the most common cause is like a muscle strain, some heavy lifting. You may have a herniated disc you worry about as well. Someone that's a little older, you worry about a ruptured aneurysm. You have this big blood vessel up front. If it ruptures, it causes severe back pain. Now, as the pain sort of localized to different areas, like say to one side, you think about a kidney infection or a kidney stone.
So lots of things to worry about there. Kidney stones, the last thing that Dr. Davis mentioned. Yeah. Rashini, what is that about?
So they literally are little stones that occur in your kidney, and it happens because in our urine there's waste particles there. And if the urine is not enough, it doesn't have enough fluid to dilute those crystals, they can actually form literally tiny little stones or pebbles. And when that happens, you get these stones, which can cause a lot of pain and inflammation in your kidney. So,
Dr. Davis, as you started this discussion of different options, how do you know if it's a kidney stone or just that regular old back pain you mentioned earlier?
Oh, you know it's a kidney stone. I had one before. It's sudden onset.
You've had one?
Oh, yeah. It's 16 years old of all ages. So young, right? But it's usually localized to one area. So you get a sharp, boom, sudden onset of pain. And the pain usually tends to travel towards the bladder. So you feel it sort of kind of doing a U shape coming up front. Whereas back pain is a bit more gradual onset, usually both sides. A kidney stone is going to make its presence known.
Yeah, I wonder how that compares to childbirth. Maybe similar. All right. So what is a kidney stone? Let's go look at it,
Sure.
Dr. Raj. So first, they can range in size from a tiny little speck like this piece of glitter here to the size of a ping pong ball. You couldn't imagine it get that large. I have seen them personally. But let me just do what the Dr. Raj show does so well. Forget about what it might look like. This is actually what they are. These are kidney stones, my friends. Now notice, they can be tiny little specks. So they look like sand. Right? Two larger pieces of gravel. These are, boulders basically when they're inside your body. So let me bring this alive to show how you get from pebbles to these big boulders inside your kidneys. So I built you a little model. This strainer effectively is your kidney, right? And not surprisingly, when you have to go to the bathroom, your kidney pours out the urine into the bladder, and boom, all the stuff comes out. It's clean, pristine, nothing, not a problem, right? All the toxins are filtered, everyone's happy. But if your urine has too many minerals, so imagine your urine now, for whatever reason, things that we'll talk about in a second, has all these minerals in there, right? Now, if they're small little minerals, it's not a problem, right? If it's diluted enough, the mineral deposits will get passed through. But if you're not diluted enough, as you start to urinate, now all of a sudden these will start to aggregate in the little bigger gatherings. Watch what you've got. Instead of passing through, now you've clumped together the bigger collections that we spoke of earlier. Let me just show you. It looks like that. And that, my friends, is painful, right? You don't want that inside of you. You want those little minerals to be able to get washed through. So why are these linked to back pain, having these larger stones?
Well, because if you have a larger stone, it's going to cause inflammation in your kidney. And when you think about where your kidney is located, it's towards the back of your abdomen. So even though it's an abdominal organ, you're really going to feel it radiating to your back. And you talked about the diet and, certain things clumping together. If you have a high protein diet, high sodium diet, if you're obese or overweight, these are risk factors. Or, of course, if someone in your families have kidney stones, you're at a higher risk as well.
But you will never forget when you have kidney stones.
No.
Let me show you why you'll get this lower back pain with a little animation, just to underline what Dr. Raj said. So there's two small organs right in the back. They're about the size of your fist. They're shaped like beans, right? That's why we call them kidney beans. And because of the size of your fist, they've got to be protected. So they actually lie behind the rib cage. And one of the ways we test is you find the spinal cord right there, and you bang the back of your chest, like right there. Not down low. People think their kidneys are down by their hips. It's way up high. And when you bang there, if the kidneys are inflamed, the patient will jump forward. And that's one of the reasons that you have the rib cage extending that low to protect the kidneys. That's what the rib cage does, protects your most vital organs. In the front, the heart and the lungs, the liver, and the kidneys in the back. So Dr. Davis, how would a doctor check and confirm if the pain is in fact from a kidney stone or one of the many other things that you gave as an option?
So one thing is to look at the urine. As the stone sort of turns in that sort of pipeline between the kidney and the bladder, it causes irritation, it may cause some blood. So we look in the urine to see if it's not blood that we can see with the eye, usually it's microscopic blood. The other thing that we do is a CAT scan. So we do a CAT scan, a dry CAT scan, no contrast, and that sort of lights up the kidneys. Today, CAT scans are readily available and very quick to access.
You got another little test. Again, simple things. You got to drink enough water. You have to have 3 servings of calcium a day. Before you get to the calcium, point out the urine here. How do you know if you're drinking enough water to actually get the goal?
Absolutely. So if you see 1, 2, and 3, very light in color, amber looks very bright. This well hydration. As you start to move 4, 5, 6, 7, obviously 8 here is very dark in color. This is dehydration, which increases your chance for a kidney stone.
So you want to be down like 1, 2, 3 range. You should be able to read through your urine. That's one of the ways as you can tell that you don't have to actually do it, but theoretically you could read through your urine. I don't want people pouring urine into a cup. My goodness, people are very little sometimes. Dr. Raj, calcium and kidney stones. I always when I was a kid, thought calcium, that makes rocks. It turns out taking calcium reduces kidney stones.
Exactly. It seems counterintuitive, but it's true. So you actually want to have plenty of calcium in your diet because calcium will actually bind some of those substances, some of those minerals that can form stones. So you want it bound to the calcium, not in your urine forming kidney stones.
All right, when we come back, you don't think your back pain is caused by kidney stones? We're going to be revealing another surprising reason for lower back pain. We're back talking about lower back pain and the reasons that dull, persistent pains don't go away. Back with me is gastroenterologist Dr. Roshini Raj. Now, we just learned that lower back pain could be caused by a kidney stone. But if you've ruled that out and other serious issues, here's something surprising that could be causing your lower back pain: what you're eating. That's right. Research now shows a link between what people eat and their chance of having low back pain. This is fascinating research.
Absolutely. One of the studies which showed almost with 4,000 people, those who had a more pro-inflammatory diet actually had a much higher chance of having low back pain. So now we know there's a big connection between what we eat and what we put in our gut and our experience of pain and inflammation throughout our body.
I want people to understand why certain foods, the ones that cause inflammation, actually can create pain in our bodies.
Yeah, absolutely. Well, what happens is if we have certain foods and they kind of disrupt the balance in our gut health and our microbiome, that can trigger inflammation. Things that invade your body through your food can then actually affect the lining of your gut. Things can leak into your bloodstream, and those can trigger inflammation throughout your body, which could cause pain in your back or, quite frankly, anywhere in your body.
Your body's whispering to you.
Right.
If you don't listen, it'll yell at you.
Listen to your inside. Listen to your gut. Yes.
Right. Listen to your gut for a reason.
That's right.
Come on back. Let's talk about which foods were shown to trigger inflammation. The ones that people can address pretty quickly.
Yeah, and these are those foods that we've always known are kind of bad guys, but now we know even more so because of the inflammatory effect. So we're talking about saturated fats, refined carbohydrates, trans fats, those are really bad in terms of inflammation, and corn oil, which is actually something people use a lot for cooking. So it's very common in our diet.
So everyone, if you're watching right now and you're having lower back pain and you think about it, you just cut these foods out, right? Just for a while, do the experiment. Could it help? We don't know, but maybe. So why not? It's better than being miserable all the time. And if someone removes these foods right now, rough idea, how long would it take for people to feel better?
Some of the functional medicine practitioners say as short as 10 days, you actually may find a benefit. And I think overall, your body's going to feel better if you cut a lot of these foods down to a minimum.
That's good no matter what.
Exactly.
Right, so Vicki Ann is joining us. Welcome to the show, Vicki Ann. You have been experiencing lower back pain for years, like a lot of people watching.
Many years.
Rough idea. You've been on, by the way, 7 days on the anti-inflammatory diet, cutting these out.
Mm-hmm.
Rough idea of how you feel.
I feel good. I feel, not only have I lost a couple of pounds, but I've actually, I feel thinner. I feel like I have more energy, like my hands and feet feel thinner.
Your rings fit again?
Yeah, I feel like, I never really thought I was puffy, but now I guess I realize because they've come down. I feel like, my flip-flops are looser now that we live in flip-flops all day. So,
the back pain that you were having before you went on this diet, describe that for me. On a scale of 1 to 10, how severe was it?
At times, it could have been a 9.
Oh.
Sometimes it kind of waxes and wanes. There could be days where it's just kind of there, and then there's other days where it's nearly crippling.
That
I've
clue,
had it
by
for
the
a long
way,
time.
that you're just offering me, that the pain is high some days, low other days, that also oftentimes means you don't have a structural issue, but you've got something related to inflammation. The body, again, not happy with something you ate the night before. So what have you done with regard to your diet? What are you eating now instead of these foods?
The diet actually changed quite a bit because there were no carbs, no dairy. I'm Italian. We like our pasta. We like our desserts, cooking and baking everything from scratch, and of course eating it. So all that changed. I thought beans were part of my healthy diet, and it even eliminated that. And also a lot more protein than I would normally consume. But I liked the way the diet was laid out because you knew what you could have, like what was a free item, so to speak, and you didn't really overeat on the other items because they gave you the measurement. So it was very easy to follow as well.
Well, I'm very happy that you're doing better. And you're only 7 days in, so it didn't even get to 10 days yet, Dr. Raj.
Very dramatic results so quickly.
Right.
And
Yeah,
it sounds
absolutely.
like what you're eating is also replacing what you're not eating, like the sugary foods, all those things that can spike insulin and cause inflammation that way. So that's great.
All right, so the key to an anti-inflammatory diet is sticking to whole, unprocessed foods that come out of the ground, looking the way they look when you eat them. So try it for 7 to 10 days and see if it'll help your back pain. We're going to put a one sheet on DrOz.com. We're going to call it the 10-day detox diet, so it's easy for you to follow. Dr. Raj, as always, thank you very much.
Thank you.
Congratulations, Vicki Ann.
Thank you.
Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.